Okay, I think everybody, we're going to start. Francesca, if we can have the next slide, please. Obviously, from my side, welcome to all of you who've given up your time to join us. And obviously, I know it's near the end of the month, but Happy New Year and compliments of the season to all of you. We hope that it's going to be a good year, particularly for malaria control. Francesca, before we actually start with our speakers, we do need to just talk to you about some webinar ground rules. So obviously all your attendees are in mute with camera off settings. Syngenta as host will record the webinar. If we have questions, we have set up a Zoom Q&A function. And obviously, if there are technical issues, please write them privately to the panelists in the chat panel. And if you have questions regarding Syngenta's data privacy practices, please see our privacy policies. So if we can then go to the next slide, I'm going to present you today's agenda now. The first talk will be on the mosquito lottery, How to Make Sure We Win by Mark Hopper from Syngenta. Then Dr. David Zinyangeri from Syngenta will address strategies to mitigate vector resistance. And after that, we will provide you two examples of really good insecticide rotation resistance management programs. One, insecticide rotation strategy by Egamal, by Kwame Desua from Egamal. And then Goodbye Malaria's Celso Alofa will talk about the Southern Mozambique's rotation experience. And after that, we will have question and answers and an open discussion. As we said, Mark Hopper is going to talk about the mosquito lottery, how to make sure we win. And just to fill in, Mark is a public health entomologist with 30 years of experience of research and development and advocacy in agricultural and public health insect control. He's currently involved in the development of novel solutions for the control of insects of public health importance, working for Syngenta in Switzerland. Mark studied crop protection at Bath University and holds an MBA in technology management. He is also the chair of the Insecticide Resistance Action Committee's IRAC public health team. He co-chairs the Rollback Malaria's VCWG's Integrated Vector Management and Insecticide Resistant Management Workstream and is a fellow of the Royal Entomological Society. Mark, you are very welcome. Thank you.
Thank you very much, Rose. Can everyone hear me okay? Yes, excellent. So, yes, good afternoon. Hello, everyone, and thank you for joining us. I'm going to talk a little bit now about the theory side of insecticide resistance management, and in particular about the value of rotations of insecticide for resistance management. So, I move to the first slide. Why isn't it moving? Yes, there we are. So for a mosquito, as the title suggests, life is really a lottery. I mean, the chances of it surviving as a larvae, being able to pupate, being able to emerge successfully as an adult, find a blood meal, and then successfully find somewhere to lay eggs. It really is a lottery that it will survive that much. And those that do are really quite lucky mosquitoes. And the thing is, these lucky mosquitoes are also the ones that can transmit malaria. Now, whilst it is a lottery for them, mosquitoes are very well adapted to this lottery. They've been playing it for millions of years. That is until scientists and vector control programs change the game. The use of insecticides for vector control has drastically reduces the chance that a female mosquito will live long enough to have offspring, and therefore also to be able to transmit malaria. Now, in a lottery, I'm just going to do that so I can see the screen better. In a lottery, only those with the right combination of numbers will win. And likewise, only mosquitoes, not with the right combination of numbers, but with the right combination of genes. Oh, I'm expecting the slide to change a bit there. No, oh, there we are. Only with the right combination of genes will be able to sort of survive. And they do this by the genes allowing them to avoid the consequences of the insecticide. Now, mosquitoes have thousands of genes, and these genes act as the blueprint for its development and its normal function. And every time a female mosquito reproduces, its genes are combined with those of the male mosquito, and they're shuffled around a bit, and some may undergo or have undergone slight changes. Now, these offspring will have similar but different combination of the genes from its parents. If this combination of genes allows it to be more successful by having more offspring, then these genes will become more common in the population. They've become selected. Now, there's nothing more successful if you want to lay eggs than still being alive. And those that are obviously controlled by the insecticides are not. So they're the unsuccessful mosquitoes. Right. So very few, if any, mosquitoes, and I do apologize for my art here. I'm not very good at drawing mosquitoes, but you'll have to imagine. So very few, if any, mosquitoes exposed to a correct application of an IRS deposit will survive long enough to have any offspring. And in this diagram, the blue ones are the susceptible ones, and the red one is the very rare resistant one that can survive. But being able to survive, it can go on and lay eggs. And then if we come back next year and look at the population, the resistant ones are now slightly more numerous as a proportion in the population. The offspring will have the similar genes to its parents, and in the case of these red resistant ones, they're able to survive. So the resistant ones become more prevalent in the population. And we might start to notice now that we're not controlling the population so well. We might notice that malaria is not being controlled as well as it could be either. As we see after our next application, we haven't controlled all the mosquitoes. And eventually, well, we have a resistant population and we're not really controlling many at all. And there's probably an awful lot more than there were to start with. Now, this is like a lottery where the winning numbers stay the same every week, but they don't tell you what the winning numbers are. However, they just tell you whether you've won or not. But if you've won, you know what numbers you had, and you're probably going to go and tell your friends and family. Well, maybe just your friends anyway, and they all use the same numbers. And eventually, everyone will use the same numbers, and everyone wins. Now, the only way the lottery organisers can stop this is to change the winning numbers. Now, in the mosquito lottery, as we've said, then it's not about numbers, it's about having the right genes. And we can change the numbers that they need, or the genes they need to be able to survive. And then we can prevent and slow these genes spreading in the population. And we can do this by changing the insecticide to one from a different mode of action than the previous one. So by rotating to a different mode of action group, the selection for resistance to the previous insecticide is reduced. And after a period, rotating back, we've changed the numbers, mosquitoes aren't happy. There we are. There we are. So if we rotate from the first mode of action to the second mode of action, then after a period of time, we can rotate back to the first. We do this through time. Maybe we're in a fortunate position that we have 3 different modes of action, and there we should rotate through those as well. Now, however, this only really works for resistance management if the mosquitoes don't already know what the winning numbers are, or don't already have the winning genes. That's to say, if they're already resistant to one of these modes of action groups, or insecticides from those modes of action groups, then the rotation isn't so effective, and probably because the mosquitoes aren't controlled as well when that mode of action class is being used. Now, mixtures of insecticides are also useful for reducing the selection pressure, or for stopping the mosquitoes winning the lottery, but only if the mosquitoes are fully susceptible to both insecticides in the mixture. Now, how do we know which insecticides are in which groups so that we can make sure that we're rotating between different modes of action groups rather than just different insecticides or different products? The Insecticide Resistance Action Committee, IRAC, this is a technical working group within the stewardship function of an organisation called CropLife International. And this is the Insecticide Manufacturers Industry Association. And IRAC has produced a mode of action classification, which allows you to identify which insecticides work in the same way and therefore are likely to be cross-resisted by the mosquitoes. And here we can see they've produced lots of posters. They've got a website you can visit to find out more information, and they even have an app you can download to your phone to help you. They also produced material that's more specific for vector control, related to just the insecticides that are PQ listed for vector control. And you can find more information again on their website and from there as well. Now, IRAC recommends that insecticide resistance management should be considered at all stages of the vector control program, right from the very beginning, the planning, the funding, to the purchasing of your insecticides, right through to application and monitoring afterwards, etc. And we also recommend that insecticide modes of action classes are rotated through time. So through best practice insecticide resistance management, the mosquitoes winning the lottery, or rather we can stop the mosquitoes winning the lottery or slow it down. And therefore we can continue to effectively control the mosquitoes that cause so much problem by transmitting and vectoring malaria. So with that, I will thank you for your attention and pass back to Rose.
Thank you, Mark. We appreciate it. And if there are any questions, you can put them in the Zoom chat and we can come back to Mark at the end of the discussion. So the next person who's going to present to us is Dr. David Zinyangeri. I think a lot of you know David. David is a qualified public health specialist. He has been in malaria vector control field for over 30 years, having worked both in the public and private sector. He has been instrumental in championing a number of vector control initiatives in a number of countries within the sub-Saharan Africa region. His experience includes working with a number of both public, private, and multilateral organizations such as the WHO, the FAO, and various USAID-funded programs. You are welcome, David, and we look forward to your presentation. Thank you.
Thank you, Rose. My presentation is derived from documents that are open publications from WHO, particularly the global program in insecticide resistance management and the other document on vector control strategies. So for those that may want to enlighten themselves further, these documents are referenced within the presentations. You'll see the references as footnotes in some areas. Thank you very much. Can we move on to the first slide? As a way of introduction, basically we all know that there's widespread and increasing insecticide resistance, which is a threat to effective malaria vector control. And because of that, we know that there is an increased burden to the disease, which then reverses the gains which we've achieved over the past decade, and continuous efforts should therefore be taken to prevent the emergence and spread of the resistance. However, within the countries, we're also saying proactive country programs are urged to develop and implement comprehensive insecticide resistance management strategies, which is why we reiterate this subject as we discussed during this webinar. Historically, we find that insecticide use has been on a sequential type of implementation, where in this particular practice, the most common way would have been to deploy one insecticide through a number of years until it's given them problems. This is ideally not a perfect way of controlling our vectors. As a result, we come up with a new way where we're saying we need to mitigate resistance developing through proactive means. Next slide. The WHO programs or various publications through the global program for insecticide resistance management states that essentially for malaria programs to ensure universal access to malaria prevention, diagnosis, and treatment are necessary as part of the pillar number 1 of the GPIRM strategy. This strategy includes effective vector control as a major component with a significant, however, with a significant budgetary allocation that is required to make sure it happens accordingly. In this regard, there are core vector control interventions that GPIRM strategy do advocate. And this is through use of products pre-qualified by WHO, applicable for all public or for all populations at risk of malaria, and particularly in most epidemiological and ecological settings. And the strategies in this regard involve insecticide-treated nets or LLINs as one strategy, using the pre-qualified insecticides. And secondly, the use of indoor residual spraying, also with pre-qualified products by WHO. However, the exception to the rule of pre-qualification is with DDT, which has not been pre-qualified. This insecticide may be used for IRS if no equally effective or efficient alternative is available. And if it is used in line with the Stockholm Convention or pesticides, organic pollutants, or on POPs. If we look at our history, since 2000, 78% of our malaria clinical cases have been averted through the interventions related to insecticide or vector control, namely through the widespread scale-up of ITNs and IRIs. And universal coverage of vector control interventions is generally considered to be the best practice to obtain optimal impact. However, in that scenario, priority to deliver both ITNs and IRS requires high coverage with a higher standard of operational activity. When I say high coverage, the standard recommendation is achieving at least 85% coverage, and with high performance in terms of efficacy of insecticides or operations. When we look at that, we then look at the second scenario, where even though we may have those core interventions, sometimes these core interventions, which are recommended to be implemented singly without being combined, there are situations where these can be combined. But however, once high coverage with one core intervention has been achieved, programs may consider deploying the other core interventions as an approach to prevent, manage, and mitigate insecticide resistance. The ITN or IRS product selected for core deployment must not contain the same insecticide, however. And for instance, if IRS with a pyrethroid should be used or deployed in the same households as ITNs are being deployed, then the decisions to deploy a second core intervention should only be taken after prioritization of analysis across the malaria interventions. Otherwise, the same insecticide should not be used for ITNs and for IRIs, because currently pyrethroids are being reserved for ITNs, as they are currently the main insecticide in ITNs. So that puts our pyrethroids in a situation where, when they are used, one has to really look at what is being used for ITNs, or ITNs being deployed or not. So next slide, please. We then look at a situation where we're saying we need to prevent, mitigate, and manage that insecticide resistance. And in this particular scenario, I derive a number of points from the global program for insecticide resistance management. And in doing that, I'd like to highlight their key principles that they indicate. Firstly, insecticides should be deployed with care and deliberation in order to reduce unnecessary selection pressure. And therefore, programs or countries should consider whether they are using insecticide judiciously, carefully, with discrimination, and if there is a clear epidemiological benefit to whatever they are doing, which is a very important aspect that we need to be aware of. Secondly, vector control programs should avoid using a single class of insecticide everywhere and over consecutive years. Instead, they should use rotation or mosaics and combinations of interventions and mixtures if those mixtures are available. I know we do have some that are being considered in that regard. Thirdly, where possible, vector control programs should diversify from pyrethroids in order to preserve their effectiveness. That is for the ITNs in particular. Although pyrethroids will continue to be used for ITNs in the current times, they should not generally be deployed for IRS in areas with ITNs, reiterating the point I highlighted earlier on. Insecticide-resistant management principles and methods should be incorporated into all vector control programs, not as an option, but as a core component of program design. Number 5, the agricultural sector should collaborate with malaria vector control programs to forge an intersectorial approach, because some of our resistance is derived from improper use or overuse in agricultural sector, which are within the same area as our epidemiological malaria, is our malaria epidemiological settings. There should be routine monitoring of insecticide resistance on a regular and sustained basis, not just a once-off program. The short-term additional cost of insecticide-resistant management should be balanced against the long-term potential of public health impact and potential costs of insecticide resistance. So those are the factors that form the basis of our insecticide mitigation strategies. In this regard, they are possible. I want to reiterate the possible strategies. First of all, we talked of mixtures. This is formulations that combine 2 or more insecticides with different modes of action. Secondly, we talked of rotations. This is switching between insecticides with different modes of action at preset time intervals, irrespective of the resistance frequencies. The theory is that the resistance frequencies will decline or at least not increase during the period of non-deployment of that particular insecticide with specific mode of action. Thirdly, we look at the mosaics. This is the deployment of insecticides of different modes of action in neighboring geographical areas. And the optimal spatial scale has to be determined for mosaics. And the rotations are generally considered to be more practical and feasible in general in most countries where I've seen this happening. And then you've got combinations. This exposes the vector population to 2 classes of insecticides with different modes of action through the co-deployment of different interventions in the same place. For instance, we can have pyrethroids, pyrethroid-only LLINs combined with non-pyrethroid IRIs, where both are at high coverage. Although there is little evidence to indicate that such combinations of interventions will lead to additional epidemiological impact relative to one intervention deployed at high coverage. But these are the kind of areas that are continuously being researched so that at least we can have complete evidence as to their benefit. Next slide, please. In all this, like I just said in my last point, continued research, we need to have evidence in order to inform our planning. So a pragmatic approach must be taken that seeks to select appropriate control interventions based on the insecticide resistance profile of the major malaria vectors in the target area. To outline how resistance will be monitored and managed, programs or countries should develop and implement national plans in accordance with the WHO framework for a national plan for monitoring and management of insecticide resistance, which is one of the areas where I've derived some of my information. Secondly, plans should be revisited regularly in order to continuously be on an updated evidence in order to do the right thing in the current time. Thirdly, one major caveat is that vector control interventions are seldom selected on a basis of resistance data alone. Such selection should also consider other influential factors specific to the local context, such as appropriateness of the intervention for housing structures, population acceptance or compliance, available capacity for deployment, cost and availability of product can also be major factors affecting resistance management. Implementation of IRM or insecticide resistance management should not come at the expense of reductions in vector control coverage for populations at risk of malaria. Next slide. I have put in a slide from the GPIRM that indicates or highlights ways of guiding resistance and the monitoring approach. I won't go over this one, but I can refer you to going through it as you get your presentation packages from the organizers. Next slide, please. This is probably my last slide. Vector control across different malaria transmission settings. Just to reiterate that here we need to understand the degree of risk of malaria transmission in a given geographical area. And this enables us to design cost-effective intervention programs that will reduce malaria burden, eliminate transmission, and prevent re-establishment of malaria. The risk of malaria transmission, product or receptivity vulnerability, which the risk is determined by product receptivity and vulnerability, and the mosquito infectivity, which is what we call the malariogenic potential. This is defined specifically in those three particular areas. We need to know what risk we are looking at. Receptivity being the evaluation of an ecosystem to malaria transmission, and that's determined by the presence of competent vectors, suitable climate, suitable human population. And the second component is the vulnerability, which is the rate of importation of parasites through the movement of infected individuals, or occasionally infected Anopheles vectors. And then the last component in that triangle is infectivity or vector susceptibility, which depends on the compatibility between the Anopheles vector and the infecting strain of Plasmodium. So consequently, programs should ensure stratification by the malariogenic potential, thus differentiate receptive from non-receptive areas. I hope this gives us a starting point to look at means and ways of mitigating insecticide resistance in our vector control programs. Next slide. Thank you very much for your attention. I hand over to Rose.
Thank you, David. Thank you very much for an interesting presentation. And now we're going to look at two programs in particular where they are practicing excellent insecticide rotation strategies, and they can address what they do. The first one, and I welcome you, Dr. Kwame Desawu from Egamal in Ghana. Kwame is currently the resident entomologist for AngloGold Ashanti Ghana in the control program there. He has an MPhil in medical entomology from the University of Ghana, and he pursued his first degree at the Kwame Nkrumah University of Science and Technology, where he graduated in a BSc in biological sciences. Mr. Desawu has a wide range of experience in public health activities, especially in the area of vector control interventions. He served as the regional biologist and coordinator for neglected tropical diseases in the Ghana Health Services for a period of 77 years. In 2013, he was seconded to the Global Fund-sponsored indoor residual spraying program for Anglo Gold Ashanti Ghana, Malaria Control Limited, to support the entomological monitoring activities of the vector control project. He has immense experience serving as a representative at AGAMAL at national and international meetings, such as the Malaria Vector Control Oversight Committee and the Rollback Malaria Vector Control Working Group meetings. Kwame, you are most welcome, and we look forward to your presentation. Thank you.
Thank you very much, Rose, and good afternoon to all participants. So, as you rightly said, my presentation is going to focus on the insecticide rotation strategy employed by AGAMAL, and this is going to be the form of my presentation this afternoon. So we quickly look at some background information, the insecticide we've used over the period, issues with resistance development, quickly also look at the resistance profile of vectors in our operational areas, and then also look at the rotation strategies that we've employed over the period. Next slide, please. Okay, so by way of background information, the vector control intervention started in Obuasi, and this was in response to the adverse impact of malaria on the mine workforce, and then consequently on its productivity. At the time, the indoor residual spraying intervention was complemented with bed nets and then larvicidin or larva source management. Following the successful implementation of the integrated vector control activity in Obuasi and then its subsequent international recognition, the vector control program applied and then received funding from the Global Fund to expand its RS activities to other districts in Ghana, and this was in 2012. Next slide, please. So by 2014, AGAMAL had increased its operational areas up to 25 districts. And however, due to the new funding model for Ghana in 2015, we saw a scale down of our activities in 25 districts to 10 districts. Luckily for us, in 2017, due to the co-payment initiative by the IBCC under its Engineer RS project, we're able to reintroduce RS back into 3 districts in the Upper East region of Ghana. As we speak, we are spraying in a total of 16 districts across the country. Next slide, please. Right, so this is the map of Ghana showing the geographic locations of our 16 operational sites. So from this map, we can see in the Upper East region of Ghana, we are spraying in 3 districts. In the Upper West region, we are spraying 11 districts. And then in Ashanti region, where the vector control project started, we are currently spraying in 2 districts, making a total of 16 operational sites. Next slide, please. Right, so with respect to the insecticide used over the period, from this slide, we can see that from 2006 up to 2013, we did 2 rounds of spraying. right? And this was basically because the insecticide that we used at the time lasted for 3 to 4 months. So this meant that for us to protect the population in the target district, we needed to spray 2 times. So that is what we did. And from the slide, we can see largely that over the period, the insecticides used belong to mainly 2 classes, that is organophosphate and then the carbamate. In 2015, we had long-lasting pyrimidine methyl, right? So, and this gave protection to the population for a period of about 9 months, right? So this meant that from 2015 we started spraying only once, right? And from this period, we could see from the slide, the insecticide used belong to the organophosphate. In 2018, we had a new mode of action insecticide coming onto the market. So we deployed clothianidin, one of the products contain clothianidin. That's the first time we introduced a new mode of action insecticide into activity. From then on, because we've used the carbamate and organophosphates for a long period of time, we switched over completely to 2019 to clothianidin, that's a new nicotinoid. In 2020, we had another mode of action insecticide, and then so currently what we are deploying is a 2 insecticides that is made up of clothianidin, that is one of the products, and then the other product made up of clothianidin and the permethrin. Right. So currently, because of the availability of this new mode of action insecticide, we are practicing our rotation based on these insecticides. Next slide, please. Right. So from the previous slide, we saw that for a long period of time, we used insecticides of from the class of organophosphates and carbamates. So this resultantly led to the development of resistance in the local vectors. And we picked this situation up, or the resistance up, as a result of our routine entomological monitoring that we carried out in selected operational sites. And in fact, the development of resistance to insecticides of the four classes actually is not unique or only related to our operational sites. Data from other monitoring activities also show that there's resistance to these classes of insecticide across other parts of the country. Next slide, please. Right, so that's a snapshot of some resistance data that we've collected in some of our operational sites. So you could see that for Obuasi, the vectors are resistant to the pyrethroids. Right back from 2014, the vectors have been resistant to the pyrethroids. Even when we introduced PBO, we realized that resistance wasn't abolished. In situations where the intensity is increased to 5 times and up to 10 times, we still see resistance in the vector population in Obuasi. In the organophosphates, around 2014, the vectors were susceptible to the organophosphates in Obuasi. Somewhere 2015, we started recording resistance to the organophosphates, and since 2015, we've never been able to to abolish or go back to the organophosphate. It's the same situation in the carbamate. We're also seeing resistance to the carbamate in Obuase from what we can see on the slide. Next slide, please. Right, so this is the situation in WA. And WA, the vectors are also resistant to the pyrethroids, as we can see, even with the combination of PBO and then the pyrethroid, we still couldn't abolish resistance. So the vectors in WA are resistant to the pyrethroids. To resistance to the organophosphates in WA, in 2014 and 2015, the vectors were susceptible in the WA area. But from 2016, we started detecting resistance to the organophosphates. And this informed our current decision to rotate using a new mode of action insecticide. Resistance to the carbamate is a similar situation in WA, where the vectors are also resistant to insecticide from this particular class. Next slide. So how are we managing our resistance issues? First on our list, we consider rotation between insecticides of different modes of action. So the plan is to change over to a new mode of action insecticide every 1 to 2 years. And that is currently what we are practicing. As part of our resistant strategy, we carry out routine resistance monitoring. So at the end of every spray season, we carry out insecticide susceptibility using the major insecticide approved by the WHO. As part of our program or operations, we also make sure that the spray operators are given adequate training so that they will be able to deliver the optimal lethal dose of the insecticide on the wall. Next slide. Right, so this slide shows our rotation strategy or our rotation of insecticide that we've used over the period. As I said, in 2012, 2013, 2014, thereabout, we used a short-term acting insecticide. And so for that matter, we sprayed twice, right? And we can see around this period, most of the insecticides used belong to the carbamate and organophosphate classes. In 2015, as I said earlier, we had a long-lasting insecticide. So we sprayed only once. And here, from 2015 to 2017, because of lack of options, I mean, we deployed this particular organophosphate as pyrinosous metal in most of our sites. From 2018 up to 2021, currently we have the new mode of action insecticide that we are deploying. So we have the opportunity to rotate between these two classes. So currently that is what we are practicing in our operational areas. Next slide, please. And so in conclusion, insecticide rotation as a resistance management strategy has been constrained by the widespread resistance to most of the available classes of insecticides. However, in recent times, with the coming in of a new mode of action insecticide, programs have the opportunity to actually implement their resistance management strategy based on what has been planned. So this, of course, will offer the programs to be able to follow their plan to the letter. Right. Thank you very much. Hello.
Very much for that. We appreciate it. And our next presenter is supposed to be Chelso Alofo from Mozambique, and he's just sent a message to say he has load shedding in his area. So I don't know. Are you there?
Yes,
Chelso?
yes.
Great.
Lucky to have
Thank
my
you.
laptop as a backup.
Oh, great. Fantastic. Thank you very much. He, Chelso, is a Mozambican citizen with over 6 years of experience in malaria entomology. He is a candidate for his MSc in infectious diseases and epidemiology at the University of Witwatersrand in South Africa, and also holds a BSc honors in applied biology from the Universidade Edward Mondlane in Mozambique. Before joining Goodbye Malaria, he worked at the Manico Health Research Center in Mozambique as a researcher under the Mozambican Alliance Towards Malaria Elimination, the MALTEM project. And he's a member of the Pan-African Mosquito Control Association, PAMCA, and co-founder of the PAMCA Mozambique's charter. He's also a member of the Mozambique's Entomology Technical Working Group, chaired by the NMCP. Chelso, you are most welcome, and we look forward to your presentation. Thank you.
Thank you, Rose. Greetings, everyone. Greetings, panelists and attendees. Unfortunately, we are in Africa, and load shedding is a reality sometimes. And unfortunately, that happened to me. Let me first begin with the introduction as a background. Please, next slide. So we actually aware what is Mozambique. So Mozambique is a country of Southern Africa. We have about 28 million inhabitants. And in terms of malaria, just last year in 2020, we registered about over 10 million cases of malaria nationwide. So in terms of the parasites that are circulating in Mozambique, we have Plasmodium falciparum, Plasmodium malariae, and Plasmodium ovale circulating, which counted for 90%, 9%, and 1% of malaria parasites circulating in Mozambique, respectively. And in terms of the core vector controls intervention that are currently being used by the National Malaria Control Program in Mozambique, we have ITNs, insecticide-treated nets, and we have IRS, indoor residual spraying. And as for the malaria vectors that are circulating or that are transmitting malaria in Mozambique, we have Anopheles venereus sensus 3.2, we have Anopheles arabiensis, and Anopheles gambiae sensus 3.2 as the main malaria vectors in Mozambique. We also have known secondary malaria vectors, which are Anopheles mirus, member of Anopheles gambiae complex, and we also have Anopheles tenebrosus, a member of Anopheles custani group that have been found to be transmitting malaria in southern Mozambique. And in terms of the National Malaria Control Program, the 2017-2020 malaria strategic plans, the NMCP aims to achieve universal coverage of any vector control tool of above 85% nationwide. We also have aiming towards subnational malaria elimination, which is happening in the Maputo province, and we are targeting to eliminate malaria in Maputo province, which is the last province on the southern part by 2025. We are also aiming to reduce the malaria prevalence on the two bordering provinces of southern Mozambique to less than 5% by 2025. So please, next slide. So just as a nutshell, as Goodbye Malaria, we began our operations in southern Mozambique in 2013, whereby we sprayed about 38,000 households in 2013, and currently we are working in 18 districts of southern Mozambique, where about the last spraying campaign, the 2020-2021 IRS campaign, we sprayed above 500,000 households, which translated to more than 1.3 million structures being sprayed in the last campaign. So we are currently working on 8 15 districts of Southern Mozambique. And as for the IRS strategy to mitigate insecticide resistance management, we are currently using the sequence. And as we can see, in 2013 to 2015, sorry, to 2013 to 2014, we began using the pyrethroids in Boane district. And then we switched to the next generation IRS that were available at the moment, which was an organophosphates. And we used for about 3 years. And then when the new chemicals were made available, were pre-qualified by the WHO to being used for public health, the novel neonicotinoids in 2018, we began to use those insecticides in Southern Mozambique. And then when the new, other new chemicals, a mixture of neonicotinoids and pyrethroids, were made also available for public health, we then started using those. And lastly, in 2020, we went back to the neonicotinoids alone as being sprayed in Boane district. And as we can see from the presentation, I tried to make it in color so it's easy to follow, that we always try to first use organophosphate as the first IRS chemical to be used for IRS. And then we switch to the newest chemicals, the neonicotinoids, and then we trying to switch back to the organophosphates to mitigate insecticide resistance development in Anopheles population. In some cases, as we can see for Magudi districts, we use the mosaic approach. So this is Magudi in 2015, whereby we had organochlorines and organophosphates being used simultaneously in a single district. We used organochlorines on the mud houses, the traditional houses, and we use organophosphates on the modern houses. We also did the same approach last year in 2020, whereby we used the combination of mixture of neonicotinoids and pyrethroids in certain houses, and we use neonicotinoids alone in different houses. But our main strategy for mitigating IRS, insecticide resistant development in IRS is a sequence. We use sequence, or also known as rotation, to mitigate insecticide resistance development. So please, next slide. So, but not everything is beautiful as we would love to. And in Southern Mozambique, unfortunately, we have a huge problem of insecticide resistant to pyrethroids. And Dr. Jacob and his colleagues did an amazing job, and whereby we found that the genes, can you please next slide? Yes, whereby the genes of the CYP69PA gene in 2002, yes, in Mozambique. The expression of these genes was very low, as we can see on panel B, but just over 15 years later, this gene became fixed in this population, and whereby to an extent that even with the PBO nets, these vectors, the Anopheles phonesis in this area of Southern Mozambique, are no longer susceptible. You can expose them for PBO-based nets for over 6 hours, they just don't die. So insecticide resistance is really a huge problem. And we got a question coming from the attendees to try and know if there isn't a link between agriculture and insecticide resistance development. In this particular area of Southern Mozambique, we have a huge fields of sugarcane plantations. We cannot say for sure that this development of these population of Anopheles phonesis resistance to pyrethroids is due to the agricultural use, but we know that these mosquitoes are coming from an agricultural area we are not seeing elsewhere. So please, next slide. So in order to mitigate this development of insecticide resistance in Mozambique, the National Malaria Control Program developed the integrated vector management plan, whereabout it incorporated the latest WHO recommendation or guidelines for insecticide resistance management. And in this IVM document, the National Malaria Control Program is recommending the usage of the three methods to mitigate, which is a sequence or rotation, mosaic, or mixtures. And in Mozambique, we have the National Malaria Control Program. We have a technical working group whereby we meet and we decide, we meet and we discuss any data that is being taken from all 11 sites of the country to whether or not we have a problem of insecticide being noticed in the country. In this same document, we have now included the colicins. We are starting monitoring colicins, specifically Aedes aegypti, because we had an outbreak of dengue in 2017, and we're now monitoring Aedes aegypti to see if there's a resistance in those populations to the chemicals that we are currently using to target malaria vectors. So to say that all that our decisions with regards to the use or not of a product to indoor residual spraying, it's all data driven and it's all discussed at the National Technical Working Group for Entomology, whereby we discuss and we see other parameters. First, we look at the entomological parameters, but we also look at the, for example, community acceptance towards one product to another. So that's about it for my presentation. I'll be taking questions after. Thank you.
Super. Chelsea, thank you for an excellent presentation, and thank you to both Kwame and Chelsea for really practical examples of how they're dealing with resistance in the field. The webinar was supposed to finish in an hour, but there are some questions to be answered, and I'm happy for you guys to continue to attend, please, until we finished. Mark, I'm going to put you on the spot first. I think we've sent you some questions. Would you like, I think Chelsea has very kindly answered the one about agricultural chemicals, but perhaps you would like to answer the other questions that came your way.
I will try to. Well, there's first of all some very interesting presentations. I'll just actually comment on the agricultural question as well, because there's been a number of people have done some studies on this, and they've found that if they collect mosquito larvae from areas where there's more intense agriculture, they grow them to adults and then they test the adults, they find them to be generally more resistant to pyrethroids than mosquito larvae collected from regions where there is less intense agriculture or no agriculture. And there's some very nice studies from Burkina Faso and the Côte d'Ivoire where they've shown that. So I think that really supports the comments that have already been made. I think the other question that was asked was around what would be the best resistance management strategy in a setting with a low but persistent transmission. Was that one of the questions?
That is correct. Yes, thank you, Mark.
So I think it's the resistance to the mosquito is related to the mosquito, not it's independent on the amount of transmission that's going on, or malaria transmission. But there is a connection, and that is you need to, if you have persistent transmission, you need to take vector control interventions. So you will be trying to control the mosquitoes. And I think the recommendations remain the same, which is that you should try and reduce the selection pressure for any one group of insecticides through a sensible rotation pattern. And there are other things that can be done as well. There was a question around the difference between a mixture and a combination. And some of that is that a combination can can also include larviciding where that's appropriate and where that's possible. But also there are other actions that should be taken just to try and reduce the mosquito population in the area as far as possible, because that will both help to reduce transmission, but it will also reduce the number of mosquitoes that can be selected. And to go back to my example of the lottery, you know, the more people who choose numbers, the more likely one of them will get it right. And it's the same with mosquitoes. So the more mosquitoes there are, the more likely it is that one of them will be able to survive exposure to the insecticide. So anything we can do to just generally reduce the mosquito population will be beneficial, and that might be through environmental management or and etc. And I think there was a second question about, are there any specific challenges relating to clothianidine for, as an IRS or resistance management? And again, clothianidine is a separate mode of action class to pyrethroids, organophosphates, carbamates, etc. So it can be used to rotate with those other classes, and it will, when it's being used, it will reduce the selection pressure on the other classes. I mentioned mixtures already, and there's, I think, really clothianidine and pyrethroid are one of the only mixtures available at the moment. And you just have to be careful that for a mixture to be really effective, the mosquitoes need to be susceptible to both insecticides used in the mixture. So if they're already resistant to a pyrethroid, then a mixture with a pyrethroid is not really offering very much in terms of benefit for resistance management. So I think that would be the consideration to take there. I hope that answers those two questions.
Thank you, Mark. Much appreciated. That's good news. David, I think we have a couple of questions for you. I think they've been sent to you. Could you answer them, please? David, you're on mute.
Hello. Yes, I was just saying I need to just add on some of the questions that have been answered by Mark, but I just want to add on to the last question on mixtures and combinations. Ideally, according to WHO, the combination, all the insecticides in the mixture should ideally have the same residual effect or life to remain bioavailable over time. Because if they're different, there could be challenges as well. And then on the combinations, Mark also explained what that means. But additionally, an example that could also be given is the use of ITNs and IRIs. It's a combination, but you're using two different actives. That's another example of a combination of interventions. And then there is a question on the ecosystems, I think, that was raised. Let me just check on that one. When the question is asking if let me just, I can't find where the question is now. But anyway, it's talking about the evaluation of ecological settings. When an insecticide is chosen, it needs to be the most appropriate in that epidemiological setting or ecological setting, which means that it must not be one that is seen aggravating the ecological systems within the epidemiological setting, i.e., if it does, there have to be mitigatory strategies to make sure that the impact on the ecology is minimized as well, which is why, for instance, when DDT is used, there are so many supplementary environmental management activities that are carried out to make sure that it does not impact on the ecological setup of the epidemiological area. So the same thing happens with all insecticides. This is what they mean when they say it has to be evaluated within the ecological setup systems as well. So basically, that explains that that particular point. The other questions that indicated, I think my presenter from Mozambique, the presenter from Mozambique highlighted it well in the presentation in terms of agricultural, the effect of agricultural use of chemicals in contributing towards resistance. I think he's touched on that. Evidence is not forthcoming as per specific area, but it is known that agricultural use of chemicals, particularly where they relate to insecticide used as adulticides, ending up in the river systems and affecting, or water bodies, affecting the larvae of the very vectors that we're trying to control as adults in the homesteads. So there are those opportunities of that happening, although I cannot give an exact example of where this has happened, but we know of these issues cropping up in various program areas.
Okay. Thank you, David. Kwame, I have some questions for you, sir.
Okay.
One is specifically in regards to the clothianidine. It is an understanding that at the moment we don't have test papers like you have used in the past for the pyrethroids and that to test for resistance.
Okay.
How are you testing for resistance with the neonics or clothianidine? And the other question is, could you talk about the use of larviciding in a rotation strategy to reduce resistance? Or could you address that?
All right. Thank you very much. I think let me start from the second one. With the use of larvicidin, with the current WHO protocol, it considers larvicidin as a supplementary intervention to the major tools. So, for example, in one of our operational areas, or Boase, what we are doing is to complement the RRS with larvicidin, right? So basically, what this does is to reduce the selection pressure on the vectors. So currently, that is what we've done. For larvicidin, we have not implemented it, or without complementing or adding the major tools, right? So, so implementing larvicidin will also, of course, reduce outdoor biting. Of course, larvicidin will reduce the vector densities, and then also reduce outdoor biting. So as a program, we've not implemented larvicidin as a standalone intervention. But what we've done in the past is to complement, use it as a complementary tool to support the major tools in Obuasi, for example. I don't know if that answers your question, right? On the bit of the next question, the second question, please.
The second question was, at this stage, we understand that there are no test papers like we have for the neonics. How do you actually test for resistance to the neonics in your area?
Right. Thank you very much. Currently, as you just stated, we don't have any insecticide papers produced by the WHO, that is for clothianidin. So what we've done as a country is to have one partner produce the insecticide papers for clothianidin. So we've worked closely with the PMI who have the capacity to produce the insecticide papers. So we obtain the clothianidin impregnated papers from the PMI for our monitoring activities. The protocol that we are currently also using is also one that is agreed upon between the PMI and then Sumitomo, right? So currently, that is the situation. We have one partner in country producing the insecticide papers just to ensure that there's that standardization and then comparability of results at the end of the day.
Super, thank you very much. We appreciate that. And I know time is moving on. Chelsea, I have a question for you, one final question, unless there are some burning questions. And that is that mixtures of insecticides are most used, no, sorry, it's not that one. It's the use of why using pyrethroids and nets.
And IRS.
I did send it to you and now I can't find it. Sorry, somebody got it for me. Howard, can you perhaps read it out? Do you have it?
Yes.
Oh, thank you. All right.
There is a question from attendee. I don't know if I should reveal the name, but okay.
No, just use it. Yeah.
And then the question is, why shouldn't we use the same insecticide for IRS and LLINs? And if we are distributing LLINs, which are expected to last at least 3 years in the field, we don't end up at one point in time using the same IRS chemical as the LLIN in the field. I think that is the question.
Yes, that is correct.
I will try and address this question briefly, but please, fellow panelists, anyone who want to chip in is welcome. I will start by saying that first, we have to look in the two perspectives. The first perspective is whether your vector populations is susceptible for the chemicals that will be used for the chemicals that is present on the LLNs that you're using. So most LLNs are currently using pyrethroids, but we now know that there are some LLNs that are being developed. We use chlorphenapyr. Or the mesh being used in the walls, you use chlorphenapyr. So you first need to know if your vectors are susceptible for the chemicals on the LLNs that you'll be using. If the vector population is susceptible, your vector population is susceptible for the chemicals that you're using for your LLINs and your IRS. In this case, they are the same. In a programmatic point of view, this is my personal point of view. From a programmatic point of view, it shouldn't be a problem. However, there is a huge problem, and that's why we had a presentation for Mark in the beginning. There's a huge problem when there is a lot of selection pressure from your vector population when you're using a single class of insecticides on your nets and also on your IRS product. We have to remember that, as Mark presented, it's all about the lotto winning numbers. So if you're using the same numbers on your bed nets and you're using the same numbers of your IRS, you're giving the mosquito population more probability to develop or to know which numbers they are using for your vector control interventions. And we have to remember that not all vectors behave the same. So, and bed nets have the first reason to be using bed nets is to prevent mosquitoes from biting. And we have vector populations where about the vectors comes and bites at the person when he's sleeping and then leave the houses or bites and rests. Whereas IRS tries to kill the mosquitoes that are resting indoors in the houses. So if you are using the same insecticides on your bed nets and your IRS, you're just giving the mosquito population the more probabilities to discover your lotto winning numbers in developing insecticide resistance. That is why it is not recommended to use the same products for bed nets and also for your IRS products at the same time. I don't know if that answer is addressed. Sorry, that question is addressed.
Very well, and I see we have one final question, and then we will call it a day, and thank you. The rotation of insecticide of different MOA is the best way to limit the resistance of mosquitoes. But as an international NGO, how can we be sure that the new product validated by the WHO can be used in the country you want to intervene in? Who are the most reliable national entity that we should ask for that purpose? I guess, again, Chelsea, the answer would be, to me, certainly it would be to speak to your Ministry of Health and your National Malaria Control Program. I don't know if anyone has a specific answer, but that's what I would say. Chelsea, would you agree with me, David?
Yes, definitely. The National Malaria Control Program would be the best, or the first port of call. And if one is not satisfied, there would be WHO within the country. They will also be able to advise.
Yeah. Okay. Thank you, everybody, for participating. Thank you to our excellent speakers. Thank you all for a really informative afternoon. I hope you enjoyed it all. Thank you for your participation, and we look forward to talking to you in the near future again. Thank you, everybody.